name is Ashley. I'll be the PA student taking care of you today. Today we're going to be doing the abdomen and musculoskeletal exam. While I go wash my hands, can I please have you take your shirt, shoes, and socks off for me and use the restroom so her bladder is empty for our abdominal exam? So starting off, I'm actually going to have you lay down right here on the bed. Yep, that's perfect. You can have your feet comfortably bent for me. I'm going to start off by inspecting the abdomen, the contour, noting any striae, distension, pulsations, masses. After I do the inspection, I forgot for inspection, I am going to inspect the condition of the umbilicus. I'm now going to auscultate in each of the 4 quadrants. For bowel sounds, if I don't immediately hear the bowel sounds, I'm going to listen for 1 full minute in each of the 4 quadrants. So I'm going to put this in my ear, right here, make sure it works. Okay. Okay, is it okay if I move this a little bit? Okay. Next, that I'm done with auscultation, I'm going to move to percussion. So starting off, I'm going to percuss each of the 4 quadrants, listening for tympany and dullness. Next, I'm going to percuss for splenic enlargement at the lowest intercostal space at the anterior axillary line. So I'm going to find that right here. I want you to take a deep breath in and then deep breath out. Okay, and then I'm going to move on to palpation. So first I'm going to ask you, do you have any areas of pain in your abdomen? Okay, if she were to have pain, I would normally palpate that area last. I would have her point it out, obviously, and then palpate last. So first I'm going to start with light palpation. So I'm just going to note any signs of distress and any, if I can feel any superficial masses. So I'm just going to go ahead. Any pain? Okay. And now I'm going to palpate all 4 quadrants again, but for deep palpation, for noting any distress, looking at her face, and also for any deep masses I can feel. Any tenderness? Okay. I'm going to palpate the liver edge now, so I'm going to have you take a deep breath in, deep breath out, and I was noting any enlargement, tenderness or masses. I'm going to move on and palpate for splenic enlargement on the left side. Can I actually have you please move with that way I'm not fully reaching over. Okay, so I'm going to have you take a deep breath in now, and then out. Okay. And then I'm now going to have you sit up for me, please. You can actually just slide right over here. I'm going to palpate for CVA tenderness bilaterally. Ready? Any tenderness? Okay, at this time I would perform a rectal exam before moving on to the musculoskeletal, but since we're not doing that, we're going to start the musculoskeletal exam. So starting off, I'm actually going to have you stand up for me right here, please. So first, I'm going to be inspecting and palpating for symmetry, edema, effusions, any deformities or malalignment of bones, muscle atrophy, tenderness, the condition of the surrounding tissue, crepitus. So starting off, I'm going to just look at the front here, and then I'm actually going to have you turn just so you're facing the wall so I can inspect the back. So I'm going to inspect the area over the spinous processes, the trapezius, the scapula, the paravertebral muscles, the area over the sacrum. I'm actually going to come to your side now and just assess the kyphotic and lordotic curvatures. Now I'm going to palpate this area right here. So I'm going to start off with the spinous processes. right here. Now I'm going to do the paravertebral muscles. So I'm going to have the trapezius right here and also scapula while I'm in the back here. The area over the sacrum, and then I'm going to find our ASIS, just palpate the sacral iliac joint. Okay, now I'm going to assess your C-spine range of motion. So I'm actually going to have you touch your chin to your chest for flexion, and then I'm going to have you extend your head back so you look at the ceiling for extension, and then I'm going to have you come in front, and I want you to turn only your head to your left, and then now to your right for rotation, and then I want you to touch your ear to your shoulder, okay, and then the opposite side, okay, and that was for lateral bending. I'm now going to have you face the camera right here. So I'm going to come on your side here. I want you to bend down and touch your toes for thoracic and lumbar flexion, and then extend as far back as you can for extension. I want you to turn to your left for rotation, and then the opposite side. There you go. And then I want you to bend to your left side. So you just go to your left. Okay, and up, and then bend to your right. Okay, perfect. Next I'm going to move on to the temporomandibular joint. So I'm going to inspect the area. I'm going to palpate. So now I want you to open your jaw, close, and then I want you to move it to the left and then right for lateral. And then I want you to bring your jaw forward for protrusion and then bring it back for retraction. Okay, now I'm going to have you sit right here. So I'm now going to inspect both sides. So I already did the scapula in the back. So I'm going to start off with the clavicle right here and palpate the area of the acromion, the acromioclavicular joint. So do like that. And then while I'm here, I'm going to get the proximal humerus right there. I'm going to try to do the bicipital groove. So do you mind? Can I have you actually sit like right here, just so I can see you with the camera? Come right here with the bicipital groove. Right there in the tendon. Moving forward, I'm going to inspect and also palpate, so the biceps right here, and then the triceps back here, the area over the antecubital fossa. We got the medial epicondyles, the lateral epicondyles. Can I have you like turn your arms like that for me? For the proximal humeral head and the olecranon process. I'm going to keep going further down the forearms right here until I get to down here. I am going to have you actually turn your hands like that so I can palpate the radial styloid process and the ulnar styloid processes. And then I'm going to move on to the carpal bones here. And I'm going to actually have your hands in a fist right here for the anatomical snuff box. Perfect. And then you can extend your fingers again. So now I'm going to palpate the sides of for the interphalangeal joints right here. Okay, now we're going to test range of motion. So I'm going to have you stand up for me, please. You can face me. So first we're going to do, you can just follow my movements, okay? So we're going to keep your arms straight and move them all the way up for shoulder flexion. Bring them, keep them straight for extension. Then you can bring them back to neutral. You can bring them out like wings for abduction, and then bring them across your chest for adduction. And then now in this position, I want you to bring your hands to your shoulders like this for elbow flexion, extend for extension, elbow extension. Bring your arms to 90 degrees, and I want you to bring your hands like this for pronation, and bring them back for supination. In this position, I want you to bring your hands towards you for wrist flexion. Bring them all the way up for extension, and then you can have your arms straight out like that. I want you to bring your fingers together for ulnar deviation and bring them out for radial deviation. Next, we're gonna do thumb flexion, so make a 4. Then you can make a fist by putting your 4 fingers for finger flexion. Extend the 4 fingers out for finger extension. Bring your thumb out for thumb extension. Then you can do, bring your fingers out like this for abduction, finger abduction. Bring them back in for adduction. In this position, you can raise your thumb for thumb abduction and bring it back for thumb adduction. And then you can touch each of your fingers for opposition. Okay, perfect. Now that we're done with that, I'm going to actually have you lay down now for the next part of the examination. So starting off, I'm actually going to have you have your legs all the way out for me, please. Thank you. So I'm going to inspect the area over the hip joint, the ASIS, the greater trochanter, and then just keep going. So palpate the hip joint, ASIS, greater trochanter. Going further down, I'm going to just inspect the leg, so the medial and lateral condyles of the femur, the patella, the patellar tendon, and the tibial tuberosity. Just do that while I'm here. Any tenderness? No. Okay. Patellas right here. Medial, lateral condyles. Okay. The patellar tendon right here, and then you get down towards the tibial tuberosity. Keep palpating. Inspect down the leg, the shin. Get down. Okay, and then I'm going to inspect and also palpate the calf. Just turn, okay. And then also the Achilles tendon in the back here. So calf right here, and then Achilles tendon. I'm just going to inspect and also palpate the medial malleolus, medial malleoli because it's plural, right here. And then the lateral malleoli right here. I'm going to inspect and then also palpate the tarsals and the metatarsals right here. Also did not forget the calcaneus, so just lifting the leg and doing that here and here. Okay, and then I'm just going to do each of these, so doing them at the same time. Sorry, my hands are like probably cold or hot, I don't know. It's weird touching people's toes. Okay, so now that we're gonna move on to assess the passive range of motion of her hip and also her knee, because it's gonna be together. So I'm actually gonna raise your leg up for hip flexion. Let me know if it's any painful during this, okay? I'm actually gonna bring your, so that was hip flexion right here. Bring it to 90 degrees for knee flexion. We're gonna extend all the way out for knee extension. I'm actually gonna bring your leg again to 90 degrees. We're gonna do internal rotation and then external rotation. I'm gonna bring it down. I'm going to stabilize your hip, and I'm gonna bring it out for hip abduction, and then bring it across for hip adduction. And then I'm going to repeat this on the opposite side. So, do you mind like just sliding over here a little bit? Stay a little bit, thank you. Okay, so I'm going to do hip flexion, and then bring her knee to 90 degrees. Actually, is there a better way? Here we go. Knee flexion, knee extension. Bring it back to 90 degrees. I'm going to do external rotation, then internal rotation. Bring it down. I'm going to stabilize the hip and do abduction and down, and then across midline for adduction and down. Okay. Next, I'm going to move down here, and I'm going to do passive. So I'm going to do dorsiflexion, plantar flexion, and then I'm actually going to stabilize the MTP joints, and I want you to curl your your toes away from you, okay? And then bring them towards you for flexion extension. While I'm on this ankle, I'm going to do inversion and eversion. And I'm going to repeat the same things on this side. So first I'm going to do dorsiflexion, plantar flexion. I'm going to do inversion, eversion, stabilize the MTP joints. I want you to curl your toes away from you for flexion and then bring them towards you for extension. Okay, now we're gonna go and measure the calf circumference. I'm gonna start on this side since my measurement wasn't, my tape was over here. So I'm gonna have you bend like right here. So I'm gonna find the widest area right here. I'm going to measure right here. Okay, so I have like 30.5 centimeters. I'm going to mark this area right here. I'm going to measure here, from this point right here. Oh. And that's 8. Okay, you can relax this leg now. I'm going to come to this side and find your tibial tuberosity. Place it, and then I'm going to mark it there and turn it over. I'm going to measure. This one's a little bit bigger, so 31.5. Okay, now you can relax. I'm going to get my goniometer to measure the angle. So I'm going to start on this side. So I'm going to have you bring your heel as close as you can to your hips, and then I'm really flexible. And then what I'm going to do is I'm going to place this on the lateral condyle of her femur. I'm going to direct this side to her greater trochanter and this side to her lateral malleolus. And so her angle is like 145 on this side. Now you can relax over here. I'm going to repeat it on this side, right? So I'm going to have perfect. So put it right on the lateral malleolus and then angle it. 145. Okay, and that concludes my examination today. I want to thank you for being my patient today.